Good afternoon, everyone. We're going to give folks just another minute to join our webinar, and then we'll be right with you. Give it another few seconds here. All right, we are going to go ahead and get started. Good afternoon, everyone. I'm Tracy Puckett. I'm the Director of Solutions for Henry Schein Medical, and I'm joined today by CueSquared, who I'll introduce to you in just a moment. First of all, I wanted to take time to mention our webinar series. This is the third webinar in our 5-part series entitled The Business of Medicine. These webinars, which you currently see listed on the screen there, were really developed as a result of feedback that we received from you, our customers. You had shared with us that from the clinical side and handling patient care, you were actually doing really well, but that it was the business complexities and the struggles with running a practice that weighed you down, that kept you up at night, and you were looking for some help and solutions in those areas. With that in mind, a few months ago, we embarked on the project of creating some webinars related specifically to the business side of medicine, which have already proved to be impactful for our customers. We really want to thank you today for joining us. We know your time is very valuable, and we hope to be able to see you again at one of the upcoming segments. The next two and last two in our series are on cybersecurity and automating your practice. Additionally, we encourage you to go to our website. It is henryscheinsolutionsHub.com, and there you can view past webinars in this series on demand, or take a look at some of the other webinars that we offer, and you will likely find something very relevant for you in your practice. So just a note on housekeeping. During this webinar, we invite you to ask questions. We really encourage that. Submit them using the question feature and go to webinar, and then we will be addressing those questions at the end. So as I mentioned earlier, this Business of Medicine series was created based on requests about what you needed from us. And we're confident that the solution you're about to see with CueSquared for mobile patient payments is not only timely, but relevant and can have a huge financial impact on your practice. As you are no doubt aware, the administrative and operational burden to collect patient payments can be painful for both you and your patients. But what if you could speed up that process, streamline it, reduce collection costs, and create a pleasant experience for the patient? Well, that is just what the experts at CueSquared are here to help you do. So I'm very pleased today to introduce you to the team from CueSquared. James Furbush is the head of marketing for CueSquared, and Jeb Burrows is the vice president of business development. So without further ado, I'm going to go ahead and pass it over to Jeb so he can take us through CueSquared.
Terrific. Tracy, thank you so much for this introduction and the opportunity to be a part of your webinar series. As Tracy mentioned, my name is Jeb Burrows. I'm the Vice President of Business Development at CueSquared. And what we thought we would do today is help anyone who's potentially evaluating a patient payment vendor with 5 timely and relevant questions that might be worth asking to get a better understanding of what the vendor offering is and how it may differentiate and augment what you currently have in play today. So as Tracy mentioned, we at CueSquared are changing the way that patients engage the financial experience with our product Mobile Pay. What we've done is taken a very unique SMS text-based approach to billing, presenting the patient with their entire billing experience unilaterally on their mobile phone. I use the word unilaterally importantly because there's no reliance on a paper statement. There is no app that needs to be downloaded to the patient's phone. And maybe most importantly, there's no login for the patient. We're making this very easy for patients and extremely easy for our customers' revenue cycle teams to accelerate cash, to reduce the cost to capture those dollars, and increase overall patient revenue while delighting and making this really simple for your patients. So let's get into this. I'll start by kind of painting the picture of the current scenario of patient revenue in the United States and healthcare. Since 2000, many of you have been providing uncompensated care. That number has climbed to as high as $620 billion in the last 20 years. Underlying that large uncompensated care is the fact that 68% of hospital bills under $500 are never paid in full. And I think we're probably speaking to the choir here, but a patient and collecting from a patient is 4 times more difficult, expensive, and timely than is from collecting from an insurance company, which is leading all of this to summarize as 82% of the groups that we're talking to, maybe 80%, 82% of those of you here today have prioritized patient revenue as one of your largest challenges in the revenue cycle. I'll draw your attention here to the right to this pie chart, and there's a company called Elevon who does payments processing in the United States across every industry, every vertical, and so forth. And every year they release a report which goes to look across industries to report what is the most difficult of all industries, in consumers' opinion, to make a payment. And as you guessed it, 46% of patients said that healthcare is the most difficult industry in which to make a payment. I look at this and am startled at airlines, who have historically always had such a poor reputation for consumer experience, are inversely 4 times better than that of a healthcare provider. And so what I want to go through here today is to help you to understand what current state is, what different can look like, and how that can affect the performance of your practice. So no doubt, as there's this enormous challenge to capturing patient revenue, there are a number of options and vendors available to solve for that problem. And you know, everything from the far left here, where you have your revenue cycle players, I'd include in there your practice management, your EMR vendor. You have specific patient revenue companies there in the middle, and all the way out to your third-party collections agencies and management organizations. It's an incredibly complicated landscape. There's a lot of overlap. There's a lot of consistently same approaches to capturing the patient dollar, which again, unfortunately, is what's driving that 46% of patients reporting that healthcare is the most challenging industry in which to make a payment. I'll pause here and make a couple assumptions about you as this audience. You are likely a hospital, health system, IDN, or large physician group. You have some semblance of these, so you're not starting from zero. You likely mail paper statements, support that with a call center. You maybe offer an electronic method for payment through a portal, whether that's your EHR or a payment-specific portal. Your patient revenue is likely 20% or more of your current outstanding revenue these days, trending in the wrong direction higher. And you believe that there must be some better, easier way to do this. You know, as a consumer yourself, and in every other aspect of your life, you're offered a variety of different ways to make payment. But in healthcare, you know, this is what you're looking at. So the first question that you should and could consider in selecting a new vendor is, what is new and differentiated about this vendor? Is it going to be worth the effort if at the other end of this process I have a new and improved way to capture patient revenue? So as I stated, the vast majority of the groups that we're working with, either our customers or our prospects that we're talking to, they're all mailing a paper statement. Oftentimes they mail 2 to 3 paper statements over a timeline of 60 to 90 days. They support those and back those up with a call center to answer questions that patients may have. The interactive voice response is a system that, you know, has taken on a lot of the call center work. Patients don't have the fondest experience with it, but it's easier for the provider side. I mentioned online payments in the forms of portals. There are e-statements, and you may be offering even a mobile solution. But oftentimes, and more often than not, what our customers realize and why we have a thriving business in place is the fact that all of these solutions, when they originate as a mobile text message, bring you back to something that looks like this. This is a login to a portal that began as a text message. And the first question is, what is your guarantor account number? Most patients don't know their account number. However, it's easily found right there on your paper statement. A second example, very similar, shows you where in the paper statement you'll be able to find your patient reference number. And lastly, do you know your quick pay code number? Because if you follow the text messages that many of these vendors are sending, you end up right here at the portal. So the question is, are you getting anything new and differentiated, or are you getting more ways to get to your portal and more ways for a patient to engage with the paper statement? The reality is that your patients outside of healthcare, and you all probably know this as consumers yourselves, are making a variety of transactions every day, all day. You trust it, you believe it's safe, it's secure. However, when patients go to pay their balance after their insurance or their outstanding deductible, they're offered poor experiences in the form of portal logins, apps to download, like you need another app on your phone. And more oftentimes than not, all of this, the entire experience is tied to a paper statement, which the Postal Service even admits 6 to 8% of it is never delivered. The second question that we feel is important is to understand performance and to understand how much transparency you as the customer will be provided by that vendor. SMS texting is incredibly different in its approach and the visibility provided. And what we're looking at here is a sample screenshot of a CueSquared customer's performance dashboard. And I use this as an example to show transparency to the life cycle of an SMS text. We know following here that 245,000 notifications were sent successfully to a patient's phone. Delivered were 236,000. We know how many were undelivered. We know what the opt-out rate is. We track for our customers where they do not have a mobile phone populated. We know that nearly 60%, 59.4% of patients opened and viewed their bill on their phone. And 27.4% of those 86,000 went on and paid their bill. That's 23,000 payments for $4.3 million in just a couple of months. The transparency is very important to know, A, is this working? Are my patients engaging with this? If you were so inclined, in this example, 59.4% of those 86,000 patients have looked at their bill and you have their verified mobile phone number. That's actionable data, actionable insight as a result of transparency. And transparency is fantastic, but what about performance? In this example, 33% of these payments were received within 24 hours. That's 7,800 payments out of the 23,000 total were made on a single text message. The patient received it, recognized their bill, took action, paid, and got right back into the hustle of the day. It's incredible. The mobile phone is really the most incredible access in the history of humanity. It's next to you 97% of the day, whether you're awake or asleep. The statistics around mobile text message open rates, 90% are opened within 5 seconds, and 96% are read within 3. Just incredible performance that really is unparalleled with other methods of communication. I'd also ask, as you're evaluating vendors, what are you paying for and how are you paying for it? The amount of complexity that's been introduced to the pricing models for a variety of different methods to capture patient revenue can be confusing. Some of the most common are straight contingency, where you as the customer will be charged a percentage of every dollar that flows through your vendor. In other instances, that contingency can be augmented with additional services. There's oftentimes a contingency plus a pass-through where you'll pay for the percentage of every dollar and be charged for paper statements or other transactional pieces. There's also the performance-based pricing, which everyone thinks is wonderful until the vendor is really performing and you feel like they're taking more than their share. And lastly, two really important questions that we find over and over again are you asked to change your payment processing relationships and or merchant banking relationships? As organizations have kind of matured and evolved in this space, they've moved more from a patient revenue company into more of a payments processing company, and therefore ask that you use their payment processor and their merchant banking relationships, both of which add somewhere between 2 and 5% revenue to the dollars they were already collecting. So be sure to really pay close attention here. Fourth is the scale of implementation, and I know that from our experience working with the revenue cycle teams, CFOs, and of course, information technology teams, this is a huge question, and in many instances is a burden to moving forward, quite frankly. The adoption of electronic health records over the last dozen years, the replacement of early adoption and so forth has put a lot of strain on those IT resources. It's important to understand that you may not have to go through a whole lot of work to get a resounding impact, or you may. And as revenue cycle leaders, you know that every day that a patient has not been billed and that balance matures further, more and more of that opportunity to collect that dollar is missed. So important to ask and to understand here is, are we talking about a 6-month implementation that you'll be paying $250,000 for? Or as in CueSquared's case, is it 4 weeks and it's free? The question needs to be asked because there is a huge amount of variability in what is currently offered in market. And the fifth question is, what are you expecting from the effort that you put into it in the form of impact? How much effort do you need to put in as an organization, across your organization, to have the desired impact you hope for in making a selection of a new patient revenue vendor? Ideally, the ideal state here is that upper left quadrant, high impact and low effort. At the other end of the spectrum is high effort and low impact. And I would challenge, back to the first question is this new and differentiated? If you're ripping out your paper statement vendor, your portal, your call center, and the rest to replace it with just the exact same with a different vendor banner, that's a whole lot of effort. And I don't believe you'll have much of a difference in impact when you get live on the other side. The other end of it, where we feel CueSquared and MobilePay lies, is in that high impact and low effort. You saw on the performance dashboard that 30 to 40% of payments arrive within 24 hours. It cost our customers $0 to implement MobilePay, and they were live 4 weeks after contract signing. It's a significant difference in a world where time, days, and even hours really matter to the ability to capture a patient payment. So some of the questions underlying there is, how much difficulty are you willing to ask a patient to incur to make their payment? How much effort will your IT and security teams need to expend to bring this solution live? And really on the back end is, how much of this has to be managed by your revenue cycle team? There are pieces and there are places in the revenue cycle where human intervention is really important. We believe that patient payments and capturing patient payments is not one of those places. MobilePay is fully automated front end and back end, driving payments at volume and speed without any human intervention at all. So let's review these 5 questions quickly, and then we'll move to questions. The first one is, take a really good look at what you have in play today and understand whether you actually have a text payment channel, a channel where a patient can make a full, complete payment via their mobile phone without a requirement for a paper statement, without logging into a portal, without having to download an app. Or is it more of the same? Are you bringing patients back to the portal and you continue to have to use a paper statement? How much transparency do you have into the performance of your vendor? It's really important. It's very easy for me to say, how much transparency do you have into a mailed paper statement, because you don't know whether it gets delivered. If it makes it to the mailbox, does it make it to the house? If it makes it to the house, does the patient open it, or does it go straight into the trash? Mobile, by comparison, is full transparent from day one through the payment being made. Understand your billing cycles and how you're being billed for the solution. Our opinion is it should be very straight, very clean, very transparent. And for MobilePay, you only pay for delivered text message notifications. Consider the scale of the implementation and how much goodwill you have within your organization to take on yet another large IT project. And lastly, in a world where speed absolutely matters, how much effort do you require to get the impact that you're hoping to of your new patient payment vendor? I appreciate the time today, and we do have about 5 to 10 minutes remaining to go through questions that might have come up as we've gone through this. So Tracy, I'll ask if there are questions that have been surfaced from the audience while we've been running through these 5 questions.
Yeah, so far we don't have any questions. However, if anyone was late, please just use the question functionality within GoToWebinar and feel free to type that in, and we will pass that question along to CueSquared to Jeb.
There are a couple I can introduce just as common in our sales cycles. One of which is a customer might say, this looks like a great solution. I just don't have mobile phone populated very often in my practice management system. How are you going to overcome that? And one of the interesting facts that we found across our base is that we have a mobile phone number for 80% of patients across the country, across our customer base, care setting, really across the entire space. 80% of the time, we have a mobile phone number for a patient. And we're able to find it because we ingest all the phone numbers per your practice management system and have the ability to find which of those is actually the mobile phone number and deliver the MobilePay notification to that patient and that patient only.
Jeb, there's still no question. So here's a question. How would this impact or help our call center?
Oh, great question. In a Mount Sinai health system case study where Mount Sinai measured the overall impact of MobilePay's launch in their overall revenue cycle. They saw a 20% reduction in call center call volume, which you can imagine if we're capturing 30–40% of payments on day one and 80% of cash within 2 weeks. Those patients and that volume of payments made does not result in an inbound call center phone call. That is now measured in many places in FTEs as we've been able to reduce that volume so much. Another interesting anecdote to that one is many of our customers track overall call volume metrics, handling time, and more often than not, we find that there's this efficiency measure, which is dollars collected per time on the phone. And if you've ever worked in or are familiar with how a call center works, one of the dreaded responses from the patient is, hold on 1 second, let me go find my paper statement. This can become a 1 minute to a 20-minute delay waiting for this patient to hopefully come back and make with the paper statement. What we found, and our customers report back to us, is that measure of dollars collected per time on the phone has actually increased because the patient has the entire balance on their phone as they're calling the call center directly from their statement. Better equipping the patient to have that financial conversation right there on the call with that call representative.
Good question. Here is one more, Jeb. How can you complete implementation so quickly, and what vendors have you integrated with?
Great questions. So we have integrated with all of the vendors that you've heard of, the Cerners, the Epics, the Athena Healths, the Allscripts, NextGen, ECW, you name it. We've integrated with all this, as well as the long tail of groups that you have not. And the important distinction is that for us to integrate, we take just a couple of files that are already present and available in every single practice management system out there. So we ask for a statement file, a patient AR file, and a few patient demographics like their phone numbers. And with those files to us, we begin to build our implementation. So in our 4-week cycle, our customer spends the first week getting us the reported files that we need to power MobilePay. The next 2 weeks we build it, and week 4 we test and go live in a 4-week start to finish timeline. Would love the opportunity to explore any of these questions with any of the audience members who are asking them. And we've put our information here, info@CueSquared.com, if you're interested in scheduling time to learn more about how MobilePay may work for your organization.
Yeah, very, very impressive implementation time there. Jeb, I don't see any more questions at this time. I'll keep watching for the next minute or so. But we want to thank you and the team so much for an excellent presentation. Those were great questions, those 5 questions for our practices to ask. And we especially want to take a moment and thank all of our customers who attended. We really hope you found this presentation to be helpful and informative. You can expect an email follow-up with some additional information. And like Jeb mentioned, please feel free to use the email you see on the screen to reach out to CueSquared or follow up with your Henry Schein rep for additional information. So it doesn't look like there's any questions, but again, thank you all for attending today, and we look forward to hearing from you.